It's the 7-Minute Drill, a fast-paced and fun conversation about common orthopedic topics and solutions with Dr. John Urse. Brought to you by
Ted's Authentic Greek Salad Dressing and Marinade. It's healthy, gluten-free, and delicious. You can find Ted's in Dayton, Ohio at Dorothy Lane Markets, Health Foods Unlimited, and Dots Markets. That's Ted's Authentic Greek Dressing and Marinade. Thanks, Ted.
We would also like to thank
Stifel's GWR Group combines more than 65 years of experience helping high-net-worth clients consolidate, coordinate, and simplify their wealth planning strategies. The group has access to a full suite of resources to serve all of your financial needs. Email gwrgroup@stifel.com or call 937-353-2863 to speak to Guy, Brad, or Jeff Richardson. Stifel, Nicholas & Company, Incorporated.
All right, Dr. Urse, Happy New Year.
Happy New Year, Terry.
It's the day after New Year's, and the Buckeyes did a great job last night. Let's just keep on pushing them forward to the national championship.
Well, we might have to do that since we're in Ohio and got to stay behind our team.
Well, that's true. First off, we want to thank our sponsors for this podcast.
Yep, Ted's Authentic Greek Dressing. We also want to thank Stifel, GWR Group, financial advisors and consultants.
Okay. So today on this topic, this is a 7-minute drill with Dr. John Urse as part of the Bone and Joint Playbook line of podcasts and information. This is a great podcast because this affects so many people. And the topic is how to avoid an infection after you have a total joint replacement. Correct? That's what we're going to talk about.
That's correct.
I got that right.
Pretty good today.
So I didn't even think about this as people were getting knees and hips and things like that, that the number one thing you were concerned with, or one of the top things, is somebody getting infected. And why is that important?
Well, I'll just tell you right now, an infection in a total joint is a disaster.
Well, why?
Because it's a deep structure. This is part of you now. You've got a new hip, you've got a new knee, a new shoulder, a new elbow, a new ankle, whatever the new part is. If you have bacteria in that joint, bacteria actually can stick like bugs or flypaper to the implant and be very difficult to get eliminated or eradicated from that area. That joint infection then continues to cause pain, swelling, drainage, and sometimes have to have the entire implant removed. Antibiotics have to be given for 6 weeks in the hospital, and a temporary antibiotic spacer placed in the joint. Then a second surgery to go put everything back in later. So
really, you have to take it out.
You may have to. So the goal here is, this is the first of the year. We have all these New Year's resolutions people make. Why not resolve to prevent a problem instead of trying to encounter it? In medicine, we say, may you never know what you prevent.
Correct.
So today we're going to talk about three things. Remember, we always try to hit three subjects. We're going to talk about what can I do to prepare for a joint replacement beforehand. Number two, what can I do during the healing period? I've just had the surgery. How am I going to get the wound to heal? What's the optimum situation for my healing environment, my nutritional status? We'll talk a little bit about that. And the third thing will be living with a joint replacement. How am I going to, go 5 years down the road and not have a problem with that? Because if, heaven forbid, you get an infection in your urinary tract, or a bad sinus infection, or a bad infection in a different body part, and that gets in the bloodstream, that could go to one of these joint replacements. Now we're dealing with what's called a late stage, or a thing called bacteremia, where bacteria in the bloodstream gets into one of these joints, causing an infection. So whether it's early or late, it's still a problem. So our goal would be to prevent these things. We're going to talk about some measures, before, during, and after these joint replacements, because the numbers are staggering. Right now in the United States alone, we do close to 750,000 knee replacements a year.
Wow.
And because of obesity, aging, and baby boomers, by the year 2030, it's estimated we'll be doing close to 1.5 to 2 million knee replacements. As our population ages, as people live longer, but they're maybe more miserable doing it. And therefore, the magnitude and the cost and the human suffering for an infection in a total joint would be really helpful if we can prevent that. So today we're going to hit a few of those topics.
So let's keep on track here. Topic number one is, how do we get prepared for a joint replacement? What are the things that you would advise me as somebody who's going to be getting a joint replacement to make sure I'm doing?
Well, and again, you've made the decision now. You've talked to your doctor. We need to do it. We've set a date. I tell people, get all your dental procedures done. If you've got a bad tooth, have your doctor extract it, or what they're going to do to fix it. Get any gum disease or any illnesses resolved, earaches, sinus problems. Get yourself an antibacterial soap. You want to scrub the surgery site and keep it clean and start preparing to have a clean area for the surgery to occur with a successful incision and healing of that area. Be sure your blood sugar is in good control.
Yeah, we're going to talk about that on a different podcast.
That'll be coming up. It'll be why an elevated blood sugar is a bad environment for a healthy hip or knee replacement, because now your blood sugar being high, you've got things for bacteria to enjoy, and we don't want them around.
To enjoy.
And so you don't want bacteria or anything anywhere near your wound. So the final thing I'd say before surgery is get your nutritional status up to par. Be sure you're taking some protein shakes. Make sure your body is able to heal a wound successfully. There's some literature that says vitamin D3 may be preventative against getting infection. So maybe increasing that before surgery, or staying on it through the surgery and after.
Well, what about putting me on an antibiotic before I go into surgery? Do you ever do that?
You absolutely will get an antibiotic immediately before the surgery. In surgery, we give it IV, high doses, and it's given to everybody. It'll be based on your allergies or your specific surgeon's requests, but everybody gets high doses. It's not common to get it after surgery very long. You don't usually need it. There are times it will be given to you if you're a high-risk patient, perhaps in oral forms afterwards.
Okay. All right, so you're getting me ready to go into surgery now. What are the things I need to do about, I guess, what is the checklist of things you would recommend that we do? So you just kind of went down the checklist.
Now you've had the surgery, you got a brand new hip or knee or shoulder or ankle, pick a body part, and now you want it to heal, right? So you want to say, where am I going to be during the recovery period? I want to have a clean environment in my home. I don't want to be on a dirty couch. I don't want to have my cat licking my wound. I want to have the wound covered. I want to have a sterile area where that wound can heal.
How long are we talking about?
A couple weeks. So you want to keep the wound clean. And this is a surgical preference. Your doctors will tell you how they want the wound cared for, what type of bandages or dressings. Some of these are waterproof, will allow you to shower. That'll be up to your doctor to tell you what they prefer. Some will say no showers for a certain amount of time. Some will say don't get it wet. Some will say a waterproof bandage over the wound is okay. And there are other things called wound vacs that are kind of a suction sponge that we use sometimes to seal the wound. And those are different circumstances. So ask your doctor what they want to do. Some people will go home with special dressings that'll get mailed to them, or they will be able to pick up at a pharmacy or medical supply place. But your doctor will tell you what they want to do with the wound. You may have a nurse coming by that'll check the wound for you in that first few week post-operative period, and that often is combined with home therapy. A lot of the insurances cover that because we're now getting people out of the hospital sooner from a procedure. Some people go home the day of surgery. We used to be in 2 weeks 25 years ago. Then it was a week. Then it was 4 days. Now, if you're in the hospital a couple of days with a joint replacement, they're thinking, holy cow, you must be really sick. So if you're healthy and you're not sick, I tell people, get out of the hospital. That's where sick people are.
Yeah.
So if you can recover at home, you have your pillow, you have your environment. Think about how that environment needs to stay successful for you to heal and also allow your wound to heal. And we'll talk a little bit about how blood sugar control is important, nutrition is important for that also.
So, okay, going forward, I'm healed. It's 6 months down the road. What are the things you think to make my hip joint replacement successful I should be doing?
Well, the first thing you want to do is always be aware of any redness or drainage or seepage from your wound from day one. Now, if it happens 4 months later or 6 months later, someone has to know about that right away. That's serious, and the sooner you can find, if it's just by the surface of the skin and not deep, that can be cleaned.
Is that a sign of infection? If you see
that, can be a sign of infection.
Okay.
So you want to have your surgeon aware of that. Often they'll be very aggressive treating that. Sometimes an antibiotic's all you need for a few days if there's redness, but if there's drainage, most people are pretty aggressive treating that so it doesn't get deeper into the wound. You also want to ask yourself what things are going to make my total joint replacement a problem 6 months to 6 years later. And it could be things that cause bacteria to get in the bloodstream. So we talked about dental procedures, colonoscopies. Anything that puts instrumentation in your bloodstream is a foreign object for your body, and you want to have some antibiotics on board for that. So for dental procedures, I recommend antibiotics for my patients that day and then just a few hours afterwards. You don't need a prolonged period.
Really? I always thought once you started antibiotic, you had to finish it.
Well, you're just doing what's called prophylaxis now. You're preventing that group of bacteria in your mouth that are being, stirred up from the gum cleaning. They're
going to come back anyway, no matter what.
They're already there.
Yeah.
You don't want them into your bloodstream. So you're going to take an antibiotic before that procedure, maybe 1 or 2, 6 hours later, and that's all you need to cover that.
Okay.
And that's, again, very regional or country specific. Some places don't do it. To me, it's very simple to give $1 worth of an antibiotic to prevent a $200,000 infection problem that's going to require surgery, IV antibiotics, and a 1 or 2 stage procedure later. So I would say, we've always said this, may you never know what you prevent. So if you have dental work, colonoscopies, I tell people even things like mani-pedis, or if you're doing manicures and pedicures and they're causing bleeding, all these things are little things that could lead to problems. It's always better to be cautious and avoid a problem than encountering it.
Okay.
The last thing I would say is just be sure your providers know you have a joint replacement. So just say, hey, I'm going to have a colonoscopy. I want you to know my orthopedic surgeon thinks you should know about it. If you don't mind, I think it'd be great to give me an antibiotic for that. Now, they may not want to do it, but at least tell them you have the joint replacement. A lot of people have a card of a special brand they have. Yeah. They should carry that or have it available to know what brand, carburetor you have.
So one quick basic question is, do I call you to get my antibiotic? Do I call my general practitioner to get my antibiotic, or do I call the guy doing the procedure to get my antibiotic? What's the best way? Well,
it's a good question because a lot of your providers, the dentists particularly, will always offer to do it. I've always told my patients, you can always call my office. We will provide you an antibiotic for that day, and we usually give them refills so that if they have another one, they don't have to call every time.
Yeah, okay.
And again, this is surgeon specific. It's probably regionally different, or even by different countries or continents. So we know this contact goes around the world, and there are people thinking, well, we don't do that. That's their choice. So again, we're just trying to keep a total joint happy for the rest of your life because you want it to function as a substitute for a painfully arthritic body part that you've just now successfully replaced.
So to end this 7-minute drill, because we went over 7 minutes, by the way, the most important thing is not the fact that somebody's going to get up too early and walk or do something different to the joint. It could be the infection possibilities of a joint replacement are the major concerns in your mind, right?
They're huge concerns, and just erring on the side of caution and realizing that you have a very valuable body part that's been replaced, and you don't ever want to have to go back and do that again. I mean, it's not unlike a heart valve. I mean, you would never want to have your chest cracked and go in and have that replaced again. Holy cow, right? So again, we err on the side of caution. I always tell people 2 things after surgery: keep track of keeping the wound clean and dry, and give it a healthy environment to heal.
Okay.
And don't fall. That is the other thing we really want you to be careful with any joint, is that you don't injure it or unsteady.
I think falls will be a great topic to cover in one of these 7-minute drills, because my father-in-law just he's 93, ended up in the hospital. Now he's in recovery at a rehab center. And
fall prevention's a big topic, and stay tuned for a future bone and joint playbook process.
All right, so we're going to land this one right now. We want to thank you all for joining us here on the 7-minute drill with Dr. John Urse. I'm Terry O'Brien, your producer, and we'll be back soon with another podcast. I think we're going to talk about blood sugar, because that's right up an alley that I go down a lot as well.
It is, and if you like the Bone and Joint podcast, make sure you like us on your social media platform.
Yes.
And invite someone else to take a listen.
All right, we'll see you all again real soon.